long story short, I have cystic fibrosis, and this is just one of my visits that was caused by respiratory failure. So basically the goal here is just to kind of get my breathing under control again, and so that I can like function not with all the help. Yeah.
So
Good.
with that being said, are you hooked up to any like breathing apparatus as well?
I'm currently on a break from the oxygen. I've been on anywhere from like 5 to 10 liters of oxygen since I've been here, which is kind of a lot. But they've been trying to wean me down because that's like the first step of me going home is not being on oxygen. I'm doing okay, but I think the doctor's going to put me back on soon.
When was your first, I'll say, episode, if that's the right terms for it?
Well, the symptoms started when I was 17, which, if you know anything about cystic fibrosis, is really rare because normally you're diagnosed at birth or like within the first like 6 months or something like that. However, I wasn't symptomatic until I was about 17. And my first hospitalization for it was like 4 days before I turned 18. So my goal was to wait until I was 18 so I can get health insurance because of like home issues. Like I didn't have health insurance, but it just happened where I didn't. So I spent my 18th birthday in the hospital. I was there for a couple weeks. I ended up getting insurance in there, so it worked out. But that was the first time that I was really bad, I guess.
So saying all that, is this something, again, I have no clue what all this is. And there's probably a lot of people are just like, oh, they've probably heard of that term. So is it just something that really just affects your respiratory system at all? Is it like, because I have chronic asthma. So when you say, okay, respiratory, I'm almost like, okay, yeah, just grab your puffer and everything will be okay. But I guess it's worse than that.
Yeah, so I guess I should go further to explain what cystic fibrosis is. So basically, it's a genetic disorder. Both of your parents have to carry the mutation for it, and it affects your respiratory system and your digestive system. So basically, your body doesn't really retain salt and like water like most people do, and so it causes like mucus to be secreted really thick and like that kind of thing, and so it like fills up your airways and your digestive organs. So but the most common like that you see the I guess the issues with it are respiratory or like with your pancreas, that kind of thing.
Gotcha. So I guess, and honestly, like I'm hearing you, but I'm trying to visualize as well. Because I see a lot of people, like, let's say, for example, with COVID happening around, everyone's coughing. I'm just like, are they like hacking up mucus now? Like, should I be concerned, or should they be concerned in regards to that? Or is it really just if you start, again, like, how are the symptoms in regards to that? And how, like, what was the path going down to it?
If I understand you correctly, I mean, the first symptoms that I had that were bad were like the coughing up stuff and the shortness of breath and hypoxia, which is when your body doesn't retain oxygen like it should.
Gotcha.
So when I got in here this time, my oxygen was about 83%, like sitting, which was not good. I don't know why I'm in here. So it has to do with a lot of complications with that sort of thing. It's not just as simple as coughing.
Gotcha.
Yeah. But I do have asthma as well and bronchiostasis. So that all just kind of ties in to really screw up my lung function.
So I guess the biggest thing, do not smoke, because that's not good.
Yeah. No. Yeah. As a CFer though, I am more susceptible to lung infections. So COVID times is hard because obviously I think if I got COVID, I might actually die. So
That's
I think a lot of people with CF are kind of afraid of that. The most like, I guess, easiest way to like kind of grasp what CF is a movie / book called 5 Feet Apart, which I think is what most people are familiar with when it comes
yes.
to yeah. It's centered around two people with cystic fibrosis. So it's a very accurate portrayal. So that's a good place to like kind of like understand it.
Okay, excellent. Okay, now I've seen that movie, and now everything started jogging into my memory bank, you'd say. So what is a typical day for you then, with this condition?
If I'm not in the hospital, which I mean, I'm not in here all the time. It's just for certain, like when this happens.
Mm.
I mean, I live like pretty normally. Most people do. I suffer a bit more from like physical exertion. I know other people with CF that like one of them is training to be a paramedic, like, or a firefighter, like stuff like that. Like they can be pretty active, like they go to the gym. For me
Mm.
though, I try to walk up a flight of stairs and I have to take a break. But I think that's more me than anything. But yeah, they live pretty normal lives we do. But treatments obviously every 4 hours or like 4 times a day, as much as I can. We have to do treatments, which for me consists of nebulizers, which are, have you ever seen it? It's like a machine that turns like a liquid medication into like an aerosol and you breathe it in.
Yeah,
Um,
yeah,
yeah. So I use Duonet, which is albuterol mixed with steroid. And then I use a saline solution, which is, for me, it's 7% salt. It's basically salt water. And that's to like encourage coughing and like that kind of thing, along with the vest, which is also in the movie. But if you've seen that, it's a percussion device that basically shakes you to encourage coughing, to
oh
like
wow.
clear out the airways. Yeah. And I'm supposed to do that like 4 times a day.
That's pretty cool and interesting as well. The whole shaking thing is just, it's like you're in like those little shake and bake bags. You just like just shake it
Yeah.
up. That is awesome. Um, have you ever met, like, so in your current state, have you met or any other person that is suffering with this condition as well?
I actually haven't. Not in person. I do have a TikTok, and but since I've been in here, I've been going live and stuff, which is how we met. Um, but not in person. I've met plenty of people though online. They reach out to me. Someone
Mm.
reached out to me over Instagram when they saw my TikTok, and like we video chat and we do treatments together and stuff like that. And we're cool. So it's nice to have people like that, but I have never met someone in person.
That's pretty cool. Like, I think the biggest thing for, I guess, any road to recovery is to ensure that you have a support system, because I
Definitely.
believe those people give you that encouragement, especially when you're going through the treatment. Um, I'm pretty sure some of those treatments can be rough at times.
Yeah, definitely.
Yeah. How are your family and friends around you? Are they like treating you like a newborn baby, or or as normal?
So as far as family goes, I don't really have close family. I have a little brother who lives in Ohio, and I live in California, so it's like almost all the way across the country from
Mm.
me. He's like my best friend. It was really hard to tell him. I think the hardest part of all this was actually telling him, and even still, I sugarcoated a little bit because I don't want him to freak out. Because
Mm.
I'm kind of not the only family he has, but kind of. Um, my mom, I don't have a relationship with her due to like abuse, that kind of thing. And my dad passed away when I was younger. But I do have some distant family, like on my dad's side, that I told recently, and they're supportive. I mean, as much as they are, Um, I don't think they treat me too much differently though, which I appreciate. I don't want to be treated like, differently just because of this. Um, yeah, and my friends, they check in on me. We're like, "Are you okay? Like, have you been doing your treatments?" I do appreciate that because I forget to a lot.
So with the whole thing with COVID going around, do you find it hard being in the hospital? And I say that because, are there protocols where you are where people can't come and visit as they want to as often? And I guess again, this is just based off assumption. I guess there's might be a few lonely days when you're in the hospital because you wish someone could come and see you and they're not there. Is that happening where you are right now?
That's fair. Yeah. Here, especially I live in the Bay Area. So the COVID restrictions are pretty strict. So there isn't any visitors allowed, I don't think. I mean, I wouldn't really expect visitors anyway, just because I don't really have any family here. There's a lady I used to live with, which she's more like a mom to me than anyone. She found out and she's like, I'm gonna come visit you. I'm like, stop, because she's like an hour and a half away from me and she has 4 kids. I'm like, you need to calm down, ma'am. So in a way, I was kind of grateful that like visitors are allowed, because every time in the hospital, she drops what she's doing and marches over here, which I appreciate. But it's just, this is like kind of a normal part of my life. So I don't want her to have to feel like she has to drop everything and like come over here and be with me just because I'm in the hospital again.
That's pretty cool. That's what I mean. Like, it's good to have that support system.
Yeah.
Even it's like, I know, like, despite what you just said, you do appreciate seeing that person.
Yeah,
And you're just like, no, don't come. But deep down, you're like, yes, please come.
we do video chat though, so it's fine. It's fine.
Yeah, yeah. I see a bunch of equipments behind you, and it looks very like techie. Um, have you ever had like fun with that stuff, or are
Fun?
you allowed to? Yeah, and I say that because, and I'll make sure no one hears this. Um, it's like sometimes you like push buttons for the sake of just pushing buttons, and just like, oh, I wonder what this does and what that does. Because the reason why I say that, I had hip surgery, and I had a similar
Mhm.
bed as you, and I put it all the way up. So the bed was like almost on angle, and the nurses came in like, "What are you doing?" I'm just like, "I don't know. I was just pushing buttons."
Well, I mean, kind of. I mean, so I'll give you a little tour, I guess, of
Yes,
what
yes.
there isn't a lot, but here, that's like the monitor. So it monitors my like oxygen level, my pulse, like stuff like that. So
Mhm,
there's nothing too crazy going on. I'm hooked up to it 24/7. Um,
mhm.
if my oxygen drops, it beeps and my nurses come in here. So
Gotcha.
not too much to mess with that. This is the vest I was telling you about. I have one of these at home, so I know how it works. So
Mhm.
I don't really mess with it too much. But yeah, it's the vest, the tubes, that kind of thing. This is an IPV machine, which stands for, I think, interpulmonary percussive ventilator, something like that. Basically, there's a thing right there that it forces oxygen, like air, into my lungs, and it's also hooked up to that saline solution I was talking about to also help with coughing and stuff. And honestly, my I know more about this than a lot of my RTs do, like my general like treatments. So like he'll leave and like put this right next to my bed so I can mess with the dials, like just how I want it, the pressure and everything. So yeah. I have a pretty good handle on like all of this stuff.
That's pretty cool. That is really cool. And the stuff behind you, I guess, is just normal hospital stuff.
Yeah, it's just like the oxygen ports, vacuums, air, that kind of thing. I also have my IV because they're giving me antibiotics right now.
That is pretty cool. It's like your best room that you ever had.
Yeah, actually, it's really nice. It's nice to be by myself because before I was diagnosed, they didn't put me by myself, so I'd be sharing a room with all these people, and it was loud. But it's whatever. But with CF, you're not really supposed to share a room because of we're more susceptible to the lung infections.
Mhm. Oh, that's good to know. That's good to
Yeah.
know. So yeah, huh? Because like it sucked because like when I was doing my recovery for surgery, I woke up and I was a room of it was just they had like just one big room, and there's I think eight to 10 people in this room, and it was just like the small curtains. I'm just like, this is very awkward.
Yeah, definitely.
That's awesome. Honestly, this is a different podcast because I will say a lot of guests that they have like mental health and how they overcome and so on and so forth. You are actually in the state where I'll say you are still going through the conditions or virus, whatever you want to call it. So what would you say words of encouragement for anyone that is going through something similar that you're going through is, or I would say, what is really, I'm not sure if it's the right term to use, but what is keeping you from just
Giving up.
correct? I don't know if you can give up in your situation though, or
Oh,
can you?
yeah, you definitely can, I think. I think
Yeah.
that being positive and pushing through, you have to make sure to actively be on top of your treatments and your medication because, again, I don't know if I mentioned it, but CF is uncurable. It's
Oh,
just a
okay.
matter
That I
of,
didn't know.
yeah, it's a matter of treating it to be as well as possible for as long as possible.
Mhm.
So if you give up, you give up, you know, that's definitely going to affect like how long you're going to live, because if you're not keeping on top of the treatments, your lungs are going to fill up, your lungs are going to stop working, that kind of thing. It's something you have to stay on top of, something you have to really work for. And I think that's true of like any sickness, really. Like if you
Mhm.
give up, like that's it, you know? Um, yeah.
So now you just raised a point and you said something, and I have to ask this question. You mentioned that it's uncurable and it's
Yeah.
possible that you could pass. Does that scare you? Or is it something that you accepted?
I'd say more it's something I've accepted. I mean, I just got my diagnosis like 3 months ago, which is really
Mhm.
surprising to a lot of people, being that I'm 21. It did take them like 4 or 5 years just to diagnose it. And at first, like, that's kind of like a blow to like, you know, like it's like, wow, like I have like a terminal illness. Like that's kind of scary.
Mhm.
However, I don't know. I don't want to sound like edgy or nothing, but I've never really struggled with the idea of death. Like it's never really scared me. Like my dad passed away when I was younger. I've known people too. Just the idea of dying, that hasn't really scared me. I think part of that too, I'm a Christian, so like part of my faith, that doesn't really scare me too much.
Mhm.
But when I was younger, like growing up in like the household, like the environment that I did, I actually recall like praying that I would develop something terminal like this. Like, and I think that's really sad to think about, like a kid, you know. But and it's kind of ironic actually, looking back now that I've been diagnosed with this in the future. But it's not really something that's really ever scared me, I don't think. The hardest
Mhm.
part again was telling the people close to me that I'm dying.
Yeah. Well, in all fairness, okay, and not to scare anybody, as soon as you're born, you are
Exactly,
planning on
yeah.
dying. So just look at it that
Yeah.
way.
That's what I'm saying. Like honestly, again, I okay, my sense of humor can be a little bit dark if you haven't noticed.
Oh, I love it. I love it.
But I joke around. I'm like, dude, you don't even know. You know, it'd be so funny. Like I'd walk outside and get hit by a car, and that's how I could go. Like no one would expect it. No one would see that coming because they think it's all this.
Mhm.
Like you know, you think about that, like anybody at any time.
That's true. So now that asks another question. Do you have a bucket list?
I do actually.
Excellent.
um, after I think actually it might have been the day up or somewhere around there. I got the diagnosis. I went to my work. I worked at a sushi restaurant to eat. I went there to eat. I didn't go there to work. I sat down at a table and like I grabbed one of the napkins and I just started writing like my bucket list. And it's always just on like this crinkled up napkin on my fridge. And I'm sure your next question is what's on it.
Of
Um,
course.
so a few key points, I guess. Um, I'm half Peruvian, so I've always wanted to go to Peru. I've never left the continental United States, so traveling is something I definitely want to do. But I want to see Machu Picchu. I think that would be really fun. I've always wanted to. I know that it's a killer hike, and I don't know if I'm prepared for that, but I would love to do that. Another one was seeing my favorite band again. I haven't seen them in 6 years now almost. But they actually announced a tour like a month later that I'm gonna go see them. So I'm really excited for that. Just like stuff like that. I mean, none of them's like really too crazy. Like on there is to learn another language, get more tattoos, stuff like that. I mean, nothing super crazy. I don't know. I feel like I want them to be like attainable goals that like I think would really make a difference to me,
Yeah.
like personally.